For the next enzyme, which we get to discuss, this is what is known as ALP. Okay, so ALP is known as alkaline phosphatase. Alkaline phosphatase. Those alkaline phosphatase, what it uses, where do you find it? Okay, so alkaline phosphatase. So just so you know, it's an enzyme and it's found in the liver, mostly, predominantly. Yes, I can also find it in the bile and also in the bones. Okay, so in chemical pathology, mostly do all those med lab stuff. So they mostly measure it in blood. So if you measure it in blood, it will get to tell you if there's issues in the liver, that's liver function. If there's issues in the bone, that's your bone health. Normally, if there's elevated levels, let me see that. Okay, we have different conditions that could make the levels go high. So let's not discuss everything in the introduction, right? So we said that it's a protein enzyme and it helps to break down phosphate compound, of course, phosphatase. Every enzyme is named according to the substrate which it works on, you know. So sources is usually found in the liver, in the bile ducts, in the bones, in the kidneys, in the intestines, in the placenta during pregnancy. So normal levels should be between what? 44 to 147 international units. So most of the times when you are looking at if the levels are high, shows you that there's a disease condition. We get to talk about those disease conditions, right? So why would doctors ask for alkaline phosphatase test? Why? Just for checkups to see if your liver is healthy, you know, liver concerns, somebody's having jaundice, abdominal pain, their urine is dark, the person is weak. Okay, I might ask for this in the test. Bone concerns. You have all those bone pains, your bone is weak, you're having fractures and you're having deformities, congenital anomalies. I'll ask for the levels of ALP in the test. So sometimes they already know that you have a condition and they are treating you for it. So I collect your results as when you came for treatment. As I'm treating you, I'm collecting further results to see how you are improving. So for the disease conditions that could make alkaline phosphatase levels go up, we have disease related to liver, like a bile duct is blocked, inflammation of the liver cells, liver cirrhosis, liver cancer, bone disorders like Paget's disease, bone cancer, your fracture is healing, okay, osteomalacia. Of course, if your fracture is healing, there's a lot of bone reactions there, you know. Other conditions like Hodgkin's lymphoma, heart failure, inflammatory bowel disease, okay. So normally, all these ones are disease conditions, right? But normally, sometimes alkaline phosphatase can be increased, like when a woman is pregnant, as a child is growing, and if you recently had a fracture, okay. So left times that could make or situations that could make this alkaline phosphatase to be low include malnutrition, um, protein deficiency, zinc or magnesium deficiency, phosphate levels are low, okay, or thyroid hormone levels are also low. So that's what we got for this enzyme.